everyone. My name is Cheryl Koehn. I'm with Arthritis Consumer Experts, and we host a program that I hope you're familiar with by now called Arthritis at Home. I'm really pleased to be joined in the studio today by Ms. Isabelle Troïtzky, who is the Secretariat of the Global Rheumatoid Arthritis Network, or Global RA Network. So welcome, Isabelle.
Hi, Cheryl. Hi, everyone. Very happy to be with you today.
So we're sitting here together for a very important reason. It is World Arthritis Day. And the Global RA Network has members from around the country. You're going to tell us a little bit more about that, Isabelle, and you're also going to share with our audience today some of the things that the Global RA Network has been working on, one particular project specifically, and you're gonna give us through a quick tour of that, and we're going to talk about how member countries and how people who are in our audience can actually get involved, which I think is something that people like me, someone living with rheumatoid arthritis, is always looking for opportunities like that. So the audience pretty much knows, we're an arthritis audience, Isabelle, knows that rheumatoid arthritis is a significant disabling chronic disease. And if you don't intervene early on after diagnosis, it can lead to really catastrophic consequences. So the model of care, so to speak, that exists at a country level is very, very important in order to provide healthcare services to these people. So it affects about 1% of the world's population. So it's not super common, but it's not uncommon. You know, 1 out of 100 people are going to have the disease, 2/3 of which are women. So with that as a bit of an informational backdrop, tell us who the Global RA Network is. Why did it form, and you know, what is the membership? What countries are involved in the network?
Yes, so the Global RA Network was founded in 2016, and by a group of 18 RA patient organizations and leaders, so from 18 countries, so they came together basically to create international relationships and start to work on common initiatives and goals to improve the lives of RA patients around the world. We count about 25 members, and it's growing, so I'm happy to say that. So around the world, Europe, Middle East, Latin America, North America, so very, very diverse group of organization, but with the same goal, and basically, you know, RA is a condition that is as important in all those countries. As you said, 1% of the population. And so ACE was one of the founding members in 2016, and so the first initiative that the members have conducted is a survey about the experiences that our patients around the world had with their disease and with the models of care. So in a nutshell, that's what this is, and we are really a network to support all members, big and small. There are differences in the resources, human and financial, that those organizations have in the different countries, and so we're basically here to help and share their voice.
Yeah, it was the word amplify comes to mind. And also be kind of connective tissue between countries who have various, you've stated, very common goals within their own country, using a different language, using a different healthcare system, but nevertheless, the principles that are well researched about how to best treat rheumatoid arthritis are universal. They're shared at several large scientific meetings every year, one in Europe and one in the Americas. And so it's a village. We're a global village of people who have this super keen interest. Tell us about, I've heard you talk about this big survey that was conducted at the time of the launching. And I know that the Global RA Network has a website and it houses the findings of that survey, which we'll give to people at the end of this chat, Isabelle, on a resource slide. But talk to us a little bit about the latest tool that the Global RA Network has developed and launched just this past June.
So yeah, this is a key initiative we got going in 22, and so we were happy to launch it on the first day of Euler, June 1st, with all the members who were present. And this is what we are calling the RA dashboard, Rheumatoid Arthritis Dashboard. And this is basically a dashboard to present in a compelling manner the facts and figures around RA in a country, and a tool that is used and will be used by the members who have the dashboard with decision makers, governments, stakeholders around the RA models of care. So we developed a standard template, if you wish, that is available online and as a PDF. And we have for now 11 dashboards that are ready from different countries around the world. So we have Colombia, Brazil, we have soon Israel, we have France, we have Canada. And this tool is very useful for the member organizations to also compare the data they have in their countries with what's available in other countries, what's not available, but also compare over time how what the progress are made around the RA models of care.
So I think I've twisted your arm to share the tool with us right now. Give us just a brief little tour of it and show two different examples of what a dashboard would look like, for example, here in Canada and perhaps Brazil or some other.
Yeah, so let's try this.
Let's see it. Oh, technology is working. That's beautiful.
Good. So you're seeing here the Brazil dashboard. You can recognize the beautiful pictures.
Exactly.
And so Brazil is well, I'll go through some of the information that is in the dashboard and tell you a bit more about how members and we as a secretariat are trying to find those data and sometimes are having difficulties finding this data, because it's not always available. So for Brazil, so as you and it's in Portuguese, so luckily I know what I'm talking about, and I don't have to translate simultaneously. But so the first part of the dashboard is really the part where we talk about general healthcare. So we give the total population, also the life expectancy for women and men in that country, the total expenditure for healthcare, as well as two key numbers for obesity and smokers, because we know that those are risks for the RA patients. So this gives kind of the general picture of healthcare, and then we go into data around arthritis and rheumatoid arthritis in the country. So as you can see, this is very visually comprehensible, and so you have that graph around rheumatoid arthritis here with the data for women and men around prevalence and incidence, but also projection for 2040. And also when we manage to get the data, what the cost of RA or arthritis is for the society, for the local country. What you see here in red on the left is a case of where we don't have access to data. And so that's often the case in different countries where either this is not publicly available or this hasn't been researched at all. So this is also important to show that this data doesn't exist or is not available.
Yeah.
It sends a message to, you know, the people. It
sends a big message. I mean, you can't fix what you can't count, right?
Exactly.
If you don't know the numbers, you can't actually develop policy or implement that policy to meet the needs.
Yeah. And then we finish with the models of care for RA, and we explain, for example, how many rheumatologists there are in the country, the time to see a rheumatologist for the first time to diagnosis, and we in the right hand side of the table of the dashboard, we share as well what are the barriers to virtual care, because we know that virtual care is very important, certainly, you know, during COVID, but also because there are so many inequities in, you know, in some countries. Access to healthcare and to a doctor sometimes is only possible through virtual care.
Yeah, so one of the reasons this tool was built was to contrast. So you're obviously delivering resources here for people in Brazil. So if we contrast this to Canada, for example.
Let me go. So that's the lovely.
Yeah, no, it looks very easy to navigate, which we know is very important.
Yeah. So, and we hope to have more of these little pictures very soon.
Yeah.
So let's go to the English dashboard for Canada. So you may understand it a bit better in English. So as you can see, we're kind of lucky in Canada because we do have data. Yeah, exactly. So again, you see general health information. We have arthritis and RA data in Canada. And what you can see is, you know, this is increasing. You see the little pictograms with the arrow turning up, and so that's basically the reality. And those two numbers that you see in the time to RA diagnosis and RA patient time wait to a first visit with a rheumatologist are actually taken from the survey that was done initially.
Okay.
And of course you have those data sources that you
so very well resourced, supported by the evidence, as we say. And this is, I mean, while we are missing in Canada because of the way healthcare is delivered here, we're missing what we would call a standardized model of care. Because in some provinces and territories, you can see, you know, a care pathway exists because your healthcare providers are making that known to you. They can show you what the pathway looks like, what you're going to anticipate next in your journey. And the care, you can enter and exit that healthcare pathway for RA somewhat obstacle-free. But that is those are exceptions, not rules, right? So the goal of the tool, and I think Isabelle takes us to my next question, is, you know, how are member countries using this dashboard as a really important advocacy tool? Because I know we all of the member countries are so excited by this tool. It got launched in June, as you mentioned, and people are really getting busy with it, right? We're now starting to use it. So maybe we can stop share and you can give us some of those examples, just a couple if you could.
Sure. As I mentioned, so we have 11 dashboards, you know, existing. we're, for example, we're working with Israel on publishing their dashboard, and they actually used the fact that they're working on that dashboard to actually go see their MPs and say, well, we can't find data. So help us fill in that dashboard.
Perfect.
And there is an issue there. So so even, you know, without that dashboard created yet, they're going with that tool to ask for data. So this is an example. Another one, Serbia just had their congress with rheumatologists a couple of weeks ago, and so they presented the dashboard to rheumatologists, who found that very useful, and definitely they will use that together to you know, to go to other stakeholders and try and improve you know, where there are gaps. And this is, you know, they were able to compare with other countries, with what very informative for rheumatologists as well.
Yeah, those are two excellent examples showing how one tool can be a calling card of sorts for in these two cases, two very different audiences, one being government, and actually showing them, look, you don't have any information. How can you fix what's ailing me if you don't count it? Back to that, you know, old adage, you can't fix what you can't count. And in the case of Serbia, sharing it with their healthcare professional audience that they're most connected with, which is your rheumatologists or community of rheumatologists that serve us. I know here in Canada, because we do have access and have posted in our dashboard, you know, most of the data that we need. The most important piece of information on that dashboard, Isabelle, is the fact that we don't have a standardized model of care. We have good healthcare some of the time, but at various stages in our journey as people with rheumatoid arthritis, we have significant gaps. And they relate to time to diagnosis, timely access to a rheumatologist for sure. It also, you know, time to get the medical management initiated and reimbursement for that medical management is a big issue for us here in Canada. And the way we are using the dashboard, and will continue to use it into 2023 for our audience members, is we have on ACE's website an advocacy toolkit. And we really encourage people to share the link to the dashboard by writing, you know, if you're not formally a part of ACE or a part of another arthritis patient organization, but you still want to take action at the individual level, you know, we applaud that. We support it in all the ways that we possibly can. And that key way is giving you the tools that you can use to talk to your elected official in your own city, in your own province, and of course, federally. So that's how we plan to use the dashboard, and particularly on World Arthritis Day, which is today, October 12th. Isabelle, you're always a font of knowledge about what's going on in the Global RA Network. We really enjoy having you on the program. We can't wait to hear about the outcomes of World Arthritis Day, to hear more from you. At the end of this video, you're going to see a slide, everyone, that has links to the Global RA Network, to ACE's advocacy toolkit, to the original survey on models of care that the Global RA Network conducted. So all kinds of great information and tools to assist you in advocating for arthritis on World Arthritis Day and on every day in the year. So thank you again, Isabelle, for joining us. We really enjoy our time together with you, and we wish everyone well out in our Arthritis at Home audience.
Well, thank you, Cheryl. It was a pleasure.
Yep.
Bye-bye.
Bye, everyone.